So now I'm going to be demonstrating how to give an intramuscular injection. Obviously, I can't use a real patient, so I'm just going to be using an orange. And just for the video's sake, I did perform proper hand hygiene before, and I am wearing gloves. So obviously, before I get into any of this, when I first go into a patient's room, I want to make sure I have the right patient. I'm giving them the right medication at the right time, the right dosage amount, and in the agreed upon route. For example, if I had already given this injection a couple hours prior and they had done it in their right deltoid, maybe now we have said that they wanted to do it in their left deltoid. So that's just something to make sure. And obviously, when you first go in, you're going to explain to the patient what you're doing, the process, like even if they have already done it before, just in case, because some people do get nervous. And if there's a new patient, you should be doing that anyways. And you're going to explain to them why, what's the medication, what's the dosage, why they are getting it in the first place. So since I'm going to be doing it on a deltoid, I would go in and ask the patient what specific arm they want me to do it on, just because it can leave your arm feeling very heavy and weak after. And just in case they are right arm dominant, maybe they want to use their left arm. And then also, it is fine if your patient is standing up or sitting, but if your patient is scared of needles or something, you would maybe want to have them sitting just in case they get nauseous or pass out while you're injecting them, just for safety reasons. So obviously I can't show you an orange, so I'm just going to demonstrate on myself before we start. Make sure that when you're going, your patient's shoulder is exposed for you and it is relaxed, because if not, it can be more painful for your patient. And you're going to use the landmarks, your acromion process, which is where your clavicle meets, and your shoulder blade. You're going to find that bony area and go 3 finger widths down from that to the thickest part of your shoulders, so right here. And that is where you're going to inject your needle at a 90-degree angle. Since I'm just going to be using sterile water, I don't have a viscous substance, so I'm just using a gauge between 20 to 25. So to get started, you're going to remove the top of the thing, the protector of it, and carefully pull back to Since I am using the deltoid, I want to make sure that I'm not using more than 2 milliliters. But for the sake of the video, I'm just going to be using 0.5 milliliter. So while you are injecting this, it is important to remember that for every milliliter, you should be going in at a speed of 10 seconds. So since I'm using half, I will just be taking 5. And I will be using the Z-track technique, which helps prevent the substance from going into sub-Q tissues and help it just stay in the muscle. So to do that, you want to push down on the patient's skin and pull away to make it a tighter surface. You're going to firmly hold it like a dart and firmly inject it into the patient's skin and push down. So since I have only half of a milliliter, I'm going to take 5 seconds. And then once I remove it, I would cover the patient with a bandage or gauze to make sure that it is all okay. Sorry, just an orange. And then I would make sure that I dispose properly of the needle and all the remaining medication. For example, the needle in a sharp box, etc.